Hello, I'm Dr. Timothy Block, President of the Hepatitis B Foundation and its Baruch S. Blumberg Institute. Both are nonprofit research organizations dedicated to improving the lives of people affected by hepatitis and hepatocellular carcinoma, or HCC, which is the major form of liver cancer. That's why I'm happy to introduce you to Glycotest, a company in which I'm a shareholder, that is taking its HCC panel, a glycoproteomic technology, into commercial use to help in the early detection of liver cancer. It's a simple blood test. My colleague, Professor Anand Mehta, and I are co-inventors of these technologies, but they're based on work we did with Nobel laureate Baruch S. Blumberg and Fellow of the Royal Society, Professor Raymond Dweck of the University of Oxford more than 20 years ago. The breakthrough is the new recombinant technology that allows these assays to be on multiple targets in a simple blood test. There are nearly 1 million deaths worldwide due to liver cancer each year. Most deaths are in China, but the incidence in the United States and Europe is growing at an alarming rate. For example, liver cancer is now the fastest growing in incidence in the United States and one of the most deadly. It's likely to surpass breast cancer as the most common cancer killer in the next 10 years. Experts agree that early detection of liver cancer is the best way to improve outcome. That's what our recombinant glycoproteomic technology, licensed to Glycotest, is intended to do, and as a simple blood test. And we have substantial evidence that it works better than current approaches. The current methods of early detection of HCC have low sensitivity and poor specificity, resulting in many cases going undiagnosed. These are missed cancers that might have been manageable, if not curable, had they been detected early. The Glycotest HCC panel detects glycoprotein biomarkers that are increased in the blood when liver cancer is present. These biomarkers show abnormally elevated amounts of the glycan called fucose when patients have specific diseases such as HCC. These glycoprotein elevations and their association with liver cancers have been shown by us and others over more than a decade. The key is that we can now detect a specific set of the liver cancer selective fucosylated glycoproteins with our recombinant fucose-binding lectins using the Glycotest HCC panel. This, we feel, is what the technology needed to make it really practical. And in a preliminary but well-controlled blinded clinical study with more than 200 HCC and liver cirrhosis patients, Glycotest's HCC panel significantly outperformed the current test for HCC. Liver cancer is a growing problem affecting millions of people. However, if detected early enough, it's manageable and in some cases curable. The good news is that the people at risk for liver cancer, that is the people who should be under surveillance, can be easily identified. With Glycotest's new non-invasive HCC panel, we believe we can improve early detection significantly and save lives through screening.